This is the eHealth Radio Network, your source for health advice on demand. And now your host, Eric Michaels.
Thanks for joining us once again here on the eHealth Radio Network. This is your host, Eric Michaels. eHealth Radio gives you the most current health information, news, and advice featuring some of the leading innovators in healthcare and wellness who are changing healthcare as we know it. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. Today we're speaking with Alexis Hunter, the community liaison for Wilmington Health, a physician-owned primary care and multi-specialty medical practice serving Wilmington in the Southeastern North Carolina area. As the community liaison, Alexis serves as a bridge between the organization and the community at large. Her role includes outreach to external providers, local employers, and community organizations. And Alexis, thanks for taking a moment to be with us here today on eHealth Radio.
Oh, you're welcome. I'm happy to be here.
And equally happy to have you with us today, Alexis, and thanks for your time and coming out today. So tell us, for starters, what current trends are you seeing with vaccinations across the U.S.? Let's kick it off with that today.
Right now, currently, they're starting to go down, and this is cause for concern. Initially, when these got ramped up in the first part of the year, there was a lot of folks getting it. There was a lot of demand for it, but that has gone down. Here in Southeastern North Carolina, we've crossed the 40% mark of folks that are eligible being vaccinated, which is good, but we still have a lot of work to do. Across the country, I think that there's still a group of folks that are in the wait-and-see category. There was recently a Kaiser Family Foundation poll. About 12% of American adults fall into that wait-and-see. 7% said they'd do it if it was required by their employer or anyone else. About 13% are still falling into that definitely not category. So we're, as primary care and specialty doctors, that's what we're working hard to do, is just to continue to encourage our patients and folks in our area to get vaccinated if they haven't already.
Yeah, thanks for the information shared and for the encouragement to get vaccinated ASAP. Now, what has changed over the past 6 months since the vaccine has been available? Any information there would be appreciated.
Well, initially, there was a scarcity of vaccines. There were far more people ready to roll up their sleeves than there were needles to put in them. And so even at Wilmington Health, when we first started at the end of January, we had 1,170 vaccines to give. Those were scheduled and taken in about 26 minutes from when we opened them. Initially, in at least North Carolina, only healthcare workers and the elderly were eligible. Over time, we opened more and more groups, and so now anyone 12 plus is eligible for the vaccine, depending on the type that they get. So that's been a big change of who has been eligible. Now pretty much everyone is if they're 12 years old and older. I think that a lot that's happened is just a concern over the side effects, over something new. Some folks have just wanted to see how others respond to it, if there's side effects or if anything out of the ordinary happens. And so I think that that's been helpful in the last 6 months for some of those with that hesitancy to see that it is safe and that people, even if they have side effects, they're only short-lived. And so that's been helpful to see. Here in our area, I work with local employers to make sure that their employees have access to the vaccine. As soon as essential workers opened up in North Carolina, the demand from our area employers was far greater than what we could supply. But they were patient each week, and they'd send a few employees each week. But now pretty much anyone who wants to get the vaccine is able to get it pretty easily here in our area.
Another question of interest, how are rural and lower income areas affected with all this?
Sure, yeah. So initially, vaccines were only distributed to hospitals and health departments. And that's difficult to get to if you are in a large geographical county with a small population where maybe your only health department or hospital is a good far ways away. And if you don't have reliable transportation, that's real hard to get to. Now, at Wilmington Health, we're in New Hanover County, Pender, Brunswick, and Onslow, but our main hub is in New Hanover County, which is a fairly small geographical county. And we're only authorized right now to give them within our county, although we could administer to residents of any county or any state for that matter. We did do some events off campus to reach areas in our city where people may not have transportation to make it easy to get that vaccine. And so that was really helpful, at least for some folks without transportation within our area. But now that more and more private practices have received authorization in our state, at least, to give the vaccine, drugstores, pharmacies, grocery stores, you can walk into many places now that are more accessible. So now, hopefully, it is much easier for folks in those rural areas to be able to have access. More and more fire departments are going into homes for homebound folks. So the past 6 months, it has become much easier for those in those rural and lower income areas.
And that's certainly good news on that front. And thanks for all the information shared so far. Really appreciate it today. We're with Alexis Hunter, Community Liaison for Wilmington Health, a physician-owned primary care and multi-specialty medical practice serving Wilmington and the Southeastern North Carolina area here on eHealth Radio's Healthcare and Health News channels, a part of the eHealth Radio Network. Now, Alexis, has one demographic been more hesitant than another that you've seen?
Well, here at our practice in Wilmington, we have really, from the get-go, been committed to be a community vaccine partner. So each time North Carolina opened up a new group, we communicated that message throughout the community, and we made every attempt to reach everyone who was eligible based on age, employment status, living situation, whatever the case may be. And every time a group opened up, we saw diversity rise as well. And that was really interesting for us to see as more essential workers, as different living situations, as different ages, we started to see more and more folks from different walks of life walk in the building to get their vaccine. I think that people are hesitant for a variety of reasons. I actually worked with some community groups in our area that specifically target folks that may be in different ethnicity groups or age groups. And I thought that some of them may be more hesitant than others, but as I had personal one-on-one conversations with leaders of these community groups, I learned that if we could get them vaccinated without the online process, without the red tape of figuring out how to schedule quickly, getting on the phone and holding, people really wanted the shot. And so as soon as we went out to these places that serve a variety of folks and allowed them the opportunity to walk in where they felt comfortable, where it was close to their house, people were lined up out the door. They really wanted them. And so I think that people are hesitant for many reasons. All ethnicities are hesitant. All age groups are hesitant. It's just something that we have to continue to educate, continue to encourage folks to get this vaccine so we can continue to move past this pandemic and get it behind us.
Also, Alexis, out of curiosity, how are you all continuing to get the word out in your community? Any input there is appreciated.
Yeah, so our marketing team continues to use billboards. Our website constantly has information for COVID vaccines, not just at our practice, but in our area as a whole. We make sure that we list every place where you can walk in or schedule an appointment to get your vaccine in the event that we don't have them available the day that you want it. We use our social media outlets. We send text messages to a listserv of folks that signed up for it. And then we continue to outreach to community organizations to find out if they need us to come and do a pop-up clinic there, or if we can help them schedule the people that use their services. I also meet weekly with representatives from our local hospital and health department to discuss our outreach efforts as a whole, to make sure we're not duplicating efforts, but also to streamline our message to the community, making sure that all of us continue to reach all age groups, all folks, to make sure that they know where to get a shot, how easy it is to do it, and how important it is to do it.
Well, we certainly do appreciate what you're doing for getting the word out and for all you're doing in your local area there in Wilmington, North Carolina, and the Southeastern North Carolina area as well. In conclusion, any closing thoughts, a takeaway, a tip, or anything else you'd like to mention as we conclude today?
Absolutely. Just if you haven't gotten that vaccine and you are eligible, roll up your sleeves, get the shot, and do what you can to help your neighbors, to help your family, to help your children to be able to move past this so we can get back to normal.
I certainly would take that advice and run with it. Really do appreciate the information and for your time here today. I'm sure listeners want to know where they could get more information on Wilmington Health Online and how one could reach out as needed. Where's the best place online to do so?
Yeah, go to our website at wilmingtonhealth.com.
And that certainly is easy enough. Again, Alexis, all the best, and thanks so much for joining us here today on eHealth Radio. Certainly was appreciated.
You too. Thanks so much.
Again, we've been speaking with Alexis Hunter, Community Liaison for Wilmington Health, a physician-owned primary care and multi-specialty medical practice serving Wilmington in the Southeastern North Carolina area. And for all the details on Wilmington Health, visit wilmingtonhealth.com. And again, this has been your host, Eric Michaels, and we do thank you for your continued support of the eHealth Radio Network. Join us again soon for another episode that will help further expand your knowledge on those things that are important to your health and wellness. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. And as always, we do thank you for tuning in.
Thanks for tuning in to the eHealth Radio Network. For more information or to subscribe to this podcast, visit eHealthRadioNetwork.com.